Hi friends, CBC or complete blood count. It consists of three sections. The first section is WBC, second is platelet, and third is the red blood indices. In the WBC section, we have total leukocyte count or TC and differential leukocyte count or DC. Among the DC, we have neutrophil, lymphocytes, eosinophils, basophils, and monocytes. Among the red blood indices, we have the RBC count, HB, MCV, MCH, MCHC, and RDW. And among the platelet section, we have the platelet count, MPV, and platelet differentiation width or PDW. Okay. One of the main difference between blood routine examination and this complete blood count is that in the blood routine examination, we have total count of the blood cells plus there will be ESR will be there. But in CBC or complete blood count, if we need ESR, we have to write it additionally. Okay. In this video, we will be dealing with the WBC section of the complete blood count. Okay. WBC, it is also called leukocytes. Their normal level in the blood is 4000 to 11,000 cells per millimeter cube. Okay. So only 1% of the total blood cells in our body. Okay. And they are of two types, that is granulocytes and agranulocytes. The granulocytes are called so because they are having both specific and non-specific granules within their cytoplasm. So they are called granulocytes. They are also called polymorphonuclear leukocytes because of their various morphology of their nucleus. Okay. And the agranulocytes are called so because they are not having specific granules within their cytoplasm. So they are called the agranulocytes. The granulocytes include neutrophils, eosinophils, and basophils, and the agranulocytes include monocytes and lymphocytes. First of all, we will come to the neutrophils. Neutrophils are the most abundant leukocyte present in the blood. It constitutes about 40 to 60% of the leukocytes, and they are distributed in four pools, that is a marginating pools, circulating pool, bone marrow pool, and in the tissues. The circulating pool, the neutrophils remain in the circulating pool for about 8 to 12 hours, and after that they move to the tissues where they remain for about 1 to 2 days. And the rest of the neutrophils, some of the neutrophils will be adhered to the endothelium, and that is a marginating pool, and the younger forms of the neutrophils will be present in the bone marrow, and that is a bone marrow pool. And the neutrophils that we count in CBC especially refers to the circulating pool. Okay. Now, in neutrophilia is a condition in which the neutrophil count goes above 60%. Okay. It is common in the bacterial infections. In the acute bacterial infections, it is a marker of acute infections, and especially in acute bacterial infection, the neutrophils will be much raised. And there is an exception, that is a tuberculosis and typhoid fever. There will be decrease in the neutrophils. And another condition is excessive steroid use. In excessive steroid use, the marginating neutrophils, the marginating pool of neutrophils will be pushed to the circulating pool, and they are not allowed to adhere to the endothelium, and so neutrophils will be raised. And in another condition, that is acute stress. In acute stress, there will be extreme levels of neutrophils, that is called the leukemoid reaction. Also in leukemia, also there will be extreme levels of neutrophils in the blood. Then how can we differentiate these two conditions, that is a leukemoid reaction and the leukemia? In leukemoid reaction, we can see that there will be much raised functional neutrophils in blood plus young forms of neutrophils like the myelocytes, band forms of neutrophils will be present. Okay. So they are functional and the young forms of neutrophils will be present. And in leukemia, in the blood, there will be immature forms of blood, especially the blast forms of the neutrophils will be present in the blood, plus non-functional neutrophils will be present. So the main function of the neutrophils, that is a defense mechanism, will be much decrease in the leukemic condition. So in order to differentiate these two conditions, either we have to do a peripheral blood smear or we can do a test called the leukocyte alkaline phosphatase. The leukocyte alkaline phosphatase or LAP is one of the specific enzyme present in the cytoplasm of the functional neutrophils. So if it is normal or if it is raised, it means that it is a leukemoid reaction, or if the LAP score is decreased, it means it is a leukemia. Okay. So these are some of the conditions in which neutrophils are raised. Now coming to neutropenia. Neutropenia is a condition in which the neutrophil count is below 4000 cells per millimeter cube. I have already told in TB and typhoid it will be much decreased. Also in certain vitamin deficiency disorders, especially the folate deficiency, the neutrophils will be much decreased. And in aplastic anemia is a condition in which the cells arising from the myeloid series of the bone marrow will be much decreased. That is the neutrophils, basophils, eosinophils, also RBC will be much decreased, but the lymphocytes will not be decreased. That is a aplastic anemia. And neutropenia is also common in the immunosuppressed conditions. That is, in any conditions, if there is any immunosuppression, there will be neutropenia, especially if there is excessive chemotherapy or certain drugs can cause neutropenia. Okay. Next we will come to the eosinophils. Eosinophils, they are actually constitute about 1 to 6% of the total neutrophils, and their main function is to resist the allergic reactions, to perform the allergic reactions and to resist the parasites. Okay, so when the eosinophil count is raised above 6%, it is called eosinophilia, and it is more common in the allergic reaction, especially the type 1 hypersensitivity reaction. The important example is asthma. Okay, allergic asthma. Okay, and the another common condition is the parasitism. It may be blood parasitism like malaria, filariasis, etc., and also intestinal parasites. In both these conditions, the eosinophils will be raised. Next, coming to the eosinopenia. Eosinopenia means the eosinophil level will be decreased. Okay, it is more common in the nutritional deficiency, especially like the vitamin deficiencies, and also in the excessive exposure to glucocorticoid drugs. Drugs like glucocorticoids which can suppress the eosinophils. Okay. Next, coming to the basophils. Basophils, they constitute only very small percentage, that is 0 to 2% of the normal neutrophils, and they are especially raised in the type 1 hypersensitivity reactions and CML, that is chronic myeloid leukemia. So basophilia in CML and type 1 hypersensitivity reaction, and basopenia is more similar. Almost all the neutrophils are actually much decreased in the immunosuppressed conditions. That is, here it is used to excessive glucocorticoid use, and also in nutritional deficiency disorders. Okay. Next, coming to the agranulocytes, that is the monocytes and the lymphocytes. The monocytes, they constitute about 2 to 10% of the neutrophils, and the importance is that they are mainly concerned with the chronic infections. Actually, we have studied neutrophils are concerned with the acute infections. The monocytes and the lymphocytes are concerned with the chronic infections. And the monocytes are especially raised in TB, syphilis, etc. Such chronic infections, monocytes will be raised, and this condition is called monocytosis. And monocytopenia, we have already discussed. In immunosuppressed conditions, monocytes will also be decreased, and in aplastic anemia and certain drugs can also cause monocytopenia. Next, coming to the lymphocytes. Lymphocytes, they constitute about 20 to 40% of the normal neutrophils, and they are of 3 types, that is the T cells, B cells, and the natural killer cells. 3 types of lymphocytes are there, and if it is much increased, it is called lymphocytosis. And we have studied that neutrophils are raised in bacterial infections, but the lymphocytes, they are specially raised in viral infections. Viral infections leads to lymphocytosis, and certain exceptions are there. In tuberculosis, that is, and pertussis, both are bacterial infections. These 2 conditions also there will be lymphocytosis, and leukemia also there will be lymphocytic, especially lymphocytic leukemia, there will be increased level of lymphocytes in the blood. And finally, coming to the lymphocytopenia, we have already told in immunosuppressed conditions, especially in HIV. In HIV, we have studied that the CD4 T lymphocytes will be much decreased in the blood, and in aplastic anemia and in radiation therapy there will be lymphocytopenia. Okay, thank you.